Thank you, Presiding Officer. May I first of all thank MSPs from across the Chamber for supporting my motion, thus enabling today's very important debate. And from the outset, may I make it really clear the valued contribution that all frontline NH staff provide in the provision of healthcare in Scotland. Presiding Officer, West Kilbride GP Surgery in North Ayrshire fell into crisis recently. In March of this year, 2 of its GPs announced that they were leaving the practice. In August, the 3 remaining doctors took the sad and very regrettable decision to hand back their practice. The surgery is now under the control of the local health board and is being manned by locums. Since April this year, it has been operating on a on-the-day appointment system. Now, these are known to be 2C practices, as they are called in the NHS, and they are thought to cost almost twice as much to run as a general practice. Now, in West Kilbride, adequate locum coverage is available until the end of November, but there are gaps in the December rota, and to date we have no detail has been provided as to what happens next year or indeed beyond. This has left many local residents feeling understandably distressed and worried. In their departing letter to local residents, the West Kilbride GPs noted, and I would like to quote from their letter, they said, "There has not been sufficient support in the form of further doctors, and due to our significant concerns over the sustainability of continuing to deliver a safe and effective service, we took the serious step of handing back our general practice contract to the Health Board." That same letter closed with the following quite poignant words. They said, "General practice can often be more than a job. It is hard for us to be leaving the families that we have been involved in over the past years. So may I therefore pay tribute to Drs Struthers, Maxwell and Barber on behalf of the local community and thank them for their many years of service." But, Presiding Officer, this is a much wider problem. It is a problem across all of Scotland, and no doubt we're going to hear some stories from other members about that today. We know, Presiding Officer, that 52 practices have returned their GP contracts to health boards. Since 2007, the number of patients being treated in 2C practices across Scotland has jumped from 83,000 to 160,000, a spike of over 90%. Now, why is that important? Well, the knock-on effect is that our A&E and acute services have seen huge increases in demand as people struggle to get access to a GP. The GMB union described the ambulance service as at breaking point. Now, before any member of the government bench, and I note they are few and far between today, stands up and says to the Chamber that this is a problem in England and Wales too, then let me save you the bother. The provision of cradle-to-grave healthcare in Scotland has been devolved to this Parliament for 20 years. The SNP has been in government for 10 of those years, and indeed the First Minister was in charge of health for 5 of those years. The situation today has been a long time coming. Let the statistics speak for themselves. It is a fact, Presiding Officer, that general practice in Scotland receives a lowest share of NHS spend anywhere in the UK. It is a fact that more than a quarter of practices in Scotland have a GP vacancy. It is a fact that 3/4 of those vacancies have been so for more than 6 months. 90% of GPs in Scotland think that their heavy workload is having a negative effect on the quality of care that they provide. And just 7% think that 10-minute consultations are adequate. Now, the government might stand up today and mention the additional £250 million investment in general practice that it has promised, but it is vital that there is a commitment to recurring and sustained investment in primary care, and indeed a measurable plan on how it will address the recruitment problem. If they don't want to listen to me, they should listen to the experts. The BMA and the RCGP have provided many MSPs with detailed and constructive recommendations, which I urge the Minister to take into account. This problem did not happen overnight. Repeated warnings from across the board all pointed to the crisis we face today, a chronic underfunding of general practice and a training and recruitment pipeline which has not met demand. It is the perfect storm. Now, given that a third of GPs plan to retire within the next 5 years, today's crises will be tomorrow's disaster. There is a duty on this Parliament to do more than just talk. There is a duty to act, and there is a duty to listen, and it's a shame that the Health Minister herself is not here to listen. But act we must, and now we must do it. The clock is ticking, Presiding Officer. I hope by bringing this debate to the Parliament today, the Government will focus its eyes once again on this crisis. Thank you.